Hi, I'm Sandy. I'm one of the medical assistants here.
Greet the patient. Ask the patient's name and date of birth and compare to the lab slip. Ask the patient where blood is usually drawn successfully. Also, ask the patient if she might faint during the procedure. When you are first learning, you may want to apply the tourniquet to palpate the vein, then remove it while you set up your equipment. The veins in this location are near the surface and tend to roll, but they are easy to see. Sanitize your hands. Put on gloves. Remove the winged infusion set from the package and straighten out the tubing. Remove the covers from the end of the tubing and the end of the syringe, and insert the syringe tip securely into the hub at the end of the tubing.
And I'm just going to put a tourniquet on your hand. Okay.
Apply the tourniquet. Cleanse the chosen site with the alcohol pad, using a circular motion and applying pressure to create friction. Allow to air dry completely. Do not touch the site again once you have disinfected it. You may dry it with the sterile gauze square. Remove the needle cover with the needle bevel pointed upward. Pinch the wings of the infusion set with your thumb and forefinger. Pull the skin behind the puncture site to flatten the vein and prevent excessive rolling.
Okay, you're going to feel a little pinch, Mary, okay?
Following the direction of the vein, pierce the skin with one quick motion and enter the vein at a flat angle, 10 to 15 degrees, almost parallel to the vein. Slowly pull back on the syringe plunger. If you have correctly entered the vein, blood will enter the syringe. Keep pulling slowly until you have obtained the required amount of blood.
You okay?
Yeah, I'm fine.
Okay. Okay, I'll just take another couple of minutes.
Remove the tourniquet by pulling up on the end of the tucked-in flap. This is important to prevent blood from being forced out of the vein by pressure when you remove the needle. Remove the needle and place a gauze pad over the site.
I'm going to have you put your hand right there in the middle. Thank you.
Activate the needle safety device and discard the needle and tubing in the biohazard waste container. Screw the blood transfer device into the syringe. Invert the syringe and push the first vacuum tube firmly into the holder section of the transfer device until the tube begins to fill. The tubes are filled in the same order as they were drawn. Remove each tube when full and rotate gently to mix until all the tubes are filled. Discard the syringe and transfer device. Label each tube with the patient's name, the date and time, and your initials. Some offices have pre-printed labels.